Hello, I'm washing my hands. I'm Sia. I'm going to be your nurse for today. I'm providing privacy. Can I get your name and date of birth?
Selena Andress, 08/13/1999.
Okay, wonderful. Checking it against the wristband and everything checks out. So today I'm going to do a head-to-toe assessment, which is just a general assessment of the body. Is that okay with you?
Yeah.
Do you have any cultural preferences that you'd like to talk about? Okay. And during this assessment, I'm going to have to touch you. Is that all right with you?
Yes.
Okay. Wonderful. So I'm going to start with questions. What time is it?
10 p.m.
All right. Can you tell me the date today?
April 26th.
Can you tell me who I am?
Sia, my nurse.
Wonderful. Can you tell me who you are?
Selena Andress.
And can you tell me where you are?
Century College Hospital.
Okay. Can you tell me why you're here today?
Having a leg pain on my left upper thigh.
Okay, so patient is alert and oriented ×4 and experiencing some leg pain. You said the location is in your left upper thigh?
Yes.
Okay, and how long have you been experiencing that?
2 weeks.
Okay, and can you tell me, can you describe it for me?
It's a dull pain.
Okay, dull pain. And then from a scale of 1 to 10, 1 being the least amount and 10 being the most amount of pain, can you rate the pain for me?
I would say 5.
A 5, okay. Is there anything that makes it better or makes it worse?
Tylenol helps.
Tylenol does help. Okay, so we'll definitely take a look at that when I take a look at your lower extremities, okay? But for now, I'll just move on to the general assessment. So hair looks clean and washed, posture is good, patient is in a good mood, behavior and demeanor is appropriate for the situation. Skin on the face is warm to the touch and dry. It's free of cyanosis, and there's no bruising or edema or swelling, and the face is symmetrical, so that's really good. I'm going to go ahead and take a look at your mucous membranes. I'll have you take a look up, and I'll have you open your mouth. Wonderful. Mucous membranes are moist and they're pink, and the skin overall looks really good. I'm also going to take a set of vitals on you. The vitals are within normal range, and the blood pressure was done with a 2-step method. So from there, I'm going to move on to your upper extremities, okay? So I'll have you actually reach out and grab my hands and grip them as hard as you can. Perfect. Grip strength is really good. We'll have you put your hands face up, push up. Wonderful. Face down, push down on my hands. Wonderful. The arm strength is equal. Just taking a general look at the skin. The skin is warm and dry to the touch, and there's no signs of bruising or edema or swelling. No lesions that I see present, no signs of cyanosis. The next thing that I'm going to do is check your capillary refill, and capillary refill is under 3 seconds, so perfusion is really good. I'll have you close your eyes. We'll go ahead and can you tell me where you feel this?
Left arm.
Okay, any pain, numbness, or tingling in that area?
No.
Okay, can you tell me where you feel this?
Right arm.
Any pain, numbness, or tingling in that area?
No.
Okay, wonderful. So we're going to check your pulses.
Okay.
I'm going to start with temporal. We're going to do carotid one at a time. We'll go to brachial. We'll go to radial. I would check femoral here. Popliteal. We're going to do posterior tib and pedal pulse. All pulses are equal, strong, and regular, so that's really good. From there, I'm going to do an eye assessment. So go ahead and hold your head still. I'll have you take a look at this pen light, and then towards the wall. Look at the pen light, towards the wall. Wonderful. The next thing I'm going to have you do with your head still is I'm going to have you follow this pen with just your eyes. Wonderful. Extraocular movement is really good. So with your head still again, I'm going to shine the light into your eyes. Good. Eyes are reacting to light. And the last thing I'm going to do with your head still is I'm going to put this pen behind your head, and you let me know when you see it.
Yeah.
Perfect.
Yeah.
Perfect. So pupils are equal, round, reactive, and accommodating to light. The next thing that I'll do after that is check your lower extremities. So here I'm going to have you put your feet up for me and push down. Perfect. Put your feet down and push up. Wonderful. Can I have you wiggle your toes? Awesome. I'm going to check the capillary refill, which is under 3 seconds, and perfusion looks really good. The strength in your lower legs was of equal strength, so that's also good. Just taking a look at your skin. There's no swelling, there's no edema, there's no bruising. It's warm to the touch. It's pink, just like your upper extremity in your face, and overall, I think you have a really good skin assessment. So the next thing that I'm going to check is your abdomen. So I'll have you lean back for me. Okay. Do you have any problems with your bowels?
No.
Okay. Any problems with urination?
No.
Peeing and pooping maybe once a day?
Yeah.
Okay, that sounds good. So the first thing I'm gonna do is have you lift up, and I'm just gonna inspect it. The skin is free of cyanosis and warm to the touch. It's dry and it's pink, so that's good. There's no swelling, there's no bruising, there's no edema. The first thing I'll do is to listen to your bowel sounds. Starting in the right lower quadrant, we're going to move in a counterclockwise motion. The bowel sounds are regular. And then again, I'm going to palpate, starting in the right lower quadrant, and move in a counterclockwise motion. The abdomen is soft to the touch, so that's really good. You can go ahead and pull your shirt down, and I'll have you sit up. Do you have any sexual health concerns that you'd like to bring up today?
Nope.
Okay. And then when was your last menses?
2 weeks ago.
2 weeks ago. Okay. Wonderful. So I'm actually going to listen to your heart next. So starting over on the right side in the second intercostal space is the aortic, and S2 is louder than S1 here. Moving on to the left side is the pulmonic, and S2 is louder than S1 here in the second intercostal space. And then moving to the fifth intercostal space is the tricuspid on the left sternal border, and S1 is louder than S2 here. And moving here to the fifth intercostal space on the mid-clavicular line is the mitral, and S1 is louder than S2. So all pulses sound equal, strong, and regular. I'm going to actually go ahead and listen to your lungs next too, if that's okay with you. Okay. So we'll start here with the bronchioles. Move over to the bronchiovesicular, and then into the vesicular. I'm going to have you take a deep breath as I move the stethoscope also. So we'll go ahead and have you turn to the back. Wonderful. And then again, as I move the stethoscope, remember to take a deep breath. Bronchial sounds will be heard up here. Bronchiovesicular. And then vesicular sounds heard at the base of the lungs. All right, wonderful. So all lung sounds are within normal range. So that's really good. So the last thing that I'm gonna have you do is I'm gonna test your posture and balance. So are you having any dizziness or feeling faint at all?
No.
Okay. So can I have you stand up? Do you feel faint or dizzy?
No.
Okay. I'll have you hold out your hands and close your eyes. We would do this with the patient for 30 seconds to note any drooping, and no drooping was noted as the 30 seconds have passed. So go ahead and put your arms down and open your eyes. Do you need any assistance walking?
No.
Okay, so I'm actually going to have you walk towards this side of the room and come back. Wonderful. The posture is good and balance is great and appropriate for age. So we're going to test your coordination. I'll have you follow my movements. So go ahead and put your hands out and face them palm down. Okay, the coordination is good and appropriate for age. I'm going to have you go ahead and sit down. Overall, I think the assessment went really well. Do you have any questions or concerns?
Nope.
Okay, so I'm going to put the call light by you. I'm going to go out and chart and note if you have any questions, give me a call. I'm washing my hands and I am leaving.